Well, good evening, everyone. It's such a pleasure to be here and to be at the start of what I think will be a very exciting and promising endeavor that you all undertake in Chicago to address some of these pressing problems that are affecting the health of all of us across the country. There's certainly a common theme tonight, from Cheryl's opening remarks to Dr. Arwadi's description of what's going on in Chicago and what some of the solutions are, and then John's presentation laying out some of the policy and strategy options to address the declining life expectancy, the burden of chronic disease and other diseases here in the US. So I'm delighted to share with you a little about the Office of the Surgeon General's Community Health and Economic Prosperity Initiative, and specifically how businesses can engage in the work of community health improvement. Let's see, I guess I have slides here. So, green, thank you. I've heard that several times and I still had to hear it again. So I mentioned what we call the CHEP initiative, Community Health and Economic Prosperity. Let me quickly point out, though, that the Office of the Surgeon General is small but mighty. We don't have a budget line, actually. We don't provide grants. We don't fund programs, and we have a very small staff. So when I say we're undertaking an initiative, we are using the bully pulpit tools of the Surgeon General. And the OSG, Office of the Surgeon General, can wield some outsized influence. Surgeon General's reports are potentially the most well-known product of the office and have been hugely impactful over the years. Most Surgeon Generals, however, are tireless communicators and make very good use of the bully pulpit to carry their message and to reach Americans everywhere. Our current Surgeon General, who deeply regrets that he could not be with you tonight, and therefore I am here in his stead, Dr. Jerome Adams, focuses on his role as the nation's doctor. And that really embraces connecting with and learning from Americans of all walks of life to help him draw attention to his other priorities. Opioid misuse, I would say, is a singular focus of the administration, of the department, and of the Office of the Surgeon General. And Dr. Adams has taken a number of actions to curb the epidemic, including his naloxone advisory and many frank conversations to destigmatize addiction. And then there's the Community Health and Economic Prosperity Initiative, which includes publication of a Surgeon General's report. So do look forward to that in the summer of 2020. In addition, we're promoting that initiative with a series of convenings across the country and with media and communication. So this is the impetus behind the Community Health and Economic Prosperity Initiative. You know this slide well. The health status of Americans is not as good as it could be, and yet we spend more than twice as much on health care as the average across the other Organization of Economic Cooperation and Development nations, our 35 peer countries, if you will. And we spend more on health care than any other country in the world. Our healthcare industry is expensive and inefficient. But I would say we also expect too much from it. We expect it to solve our health problems, actually. And what we know is that healthcare is actually just a small part of the health equation, if you will, about 15%. While we overinvest in healthcare and generally don't get value on that investment, don't get the outcomes that we're looking for in terms of health, as John mentioned, we underinvest in the other things that shape our health. Things like quality housing, decent jobs at decent wages, quality education, healthy and safe communities, access to healthy foods, and early childhood development. Which are part and parcel of our income inequality and lack of economic opportunity in this country. Right now in the US, the strongest predictor of a child's future earnings is his father's earnings. Nearly 50% of the variation in sons' earnings is predicted by their father's earnings a generation ago. In more egalitarian countries across Europe, it's only 20%. In the US these days, there's very little movement out of the economic status into which we are born. We think we're the land of opportunity, but we're not seeing that economic opportunity across our country. The Community Health and Economic Prosperity Initiative is targeting those kinds of problems. It won't solve those problems, but it is laser focused on those problems. And it is, we expect it to add to the host of other movements and organizations that are working in this space. And I'll call out the Robert Wood Johnson Foundation's Culture of Health and Culture of Health for Business in particular, working to improve the health of all Americans and to unleash a more sustainable and equitable prosperity. CHEP emphasizes the role of private sector businesses, and it aims to mobilize businesses as change agents, investing in their communities to improve the conditions that drive health and to begin to demand of themselves, of others, and even of our government the policies and practices that promote health and prosperity for all. And I'll call out John's recent publication, those 13 policies and practices that are known to deliver a health impact. The Surgeon General hopes to make the case that it is in business's best interest, properly understood, to take these kinds of actions, and that these actions, these investments in community, will return a value to the business. Now, value can take many forms. Investing in communities and investing in the policies and practices that promote health and prosperity for all can deliver a healthier population and lower healthcare costs, can deliver healthier workers who are more productive on the job and more loyal to the company, can deliver increased value to the brand as consumers and customers approve of the business's value and principles. And value can also be plain old money. If a business joins a venture to build affordable worker housing, low and mixed income housing, that investment can return a value of profit. So the Surgeon General hopes to convince businesses that investing in communities is good for business, and to inspire businesses to make those investments and claim a stake as community members with vested interests in the well-being of the community, not in place of government, but doing its part even as it encourages government and everyone else to do their part. We call this community investment the zip code improvement business. You've all heard the saying that a person's zip code is more important than their genetic code in determining their health. If we want that not to be the case, if we don't want where you're born to determine your life chances, we have a lot of zip codes to improve across our country and within our neighborhoods and within our cities. Businesses can and should be one of the community change makers working alongside others to improve our zip codes. The things that determine the quality of a zip code or a community, things that we've heard our previous speakers talk about: quality housing, quality education, access to transportation, and what our Department of Labor calls family-sustaining careers. These are all upstream of the costly problems that we address every day: those debilitating chronic diseases, addiction and substance misuse, poor maternal and child health outcomes, inability to recruit and retain workers, and our high healthcare costs. We used to say in public health, where my career has been, that upstream work involved changing people's behaviors. We could prevent heart disease, cancer, diabetes if we could get people to stop smoking, to start exercising, and eating a healthy diet. But now we know those poor health behaviors are pretty far downstream. And if we want to prevent those behaviors from happening in the first place, we need to move even farther upstream to the root causes. The way upstream causes are income inequality and lack of economic opportunity, and then the conditions that those causes beget, like poor housing, inadequate education, lack of jobs, lack of access to health care, lack of access to healthy foods, all the things that we've heard about. So that's what we mean when we say policies and programs that improve upstream causes of poor health and increase economic opportunity. So what are these policies and practices? I'm sure you'll want to know. Well, they're the evidence-based policies and practices that we know well, that we saw in John's slides, including paying a living wage, including providing health insurance, including paid sick leave, occupational health and safety and other worker protections, responsible marketing practices, and reducing negative community environmental impacts. So that's one slate of policies and practices. Then there's what you might think of as traditional investment. Businesses invest all the time, so do philanthropies. They can invest in the stock market and get a return. They can invest in community development and get a return. Businesses can work with local government, with community development financial institutions and community development corporations, with commercial banks, with philanthropies and planners to invest in community-identified needs like affordable housing for workers and families, quality child care and early learning, and other kinds of community investments. Then there's pretty much everything else or anything else that you can think of that has the potential to be transformative in a community. And I'll give you just a couple of examples. Belden Industries in Richmond, Indiana. They found themselves unable to fill vacant positions, even though they had many applicants. The problem was that the applicants couldn't pass a drug test. So the company implemented a novel solution which has the potential to transform the town of Richmond with a population of 35,000. Every applicant who failed the drug test was supported through treatment by the company. If they completed the treatment, they got a job, and the company continued to support their recovery. This is a win for the company that gets to fill vacant positions. It's a win for the employee who has an opportunity to turn his or her life around. And it's a win for the community who has transformed an individual who might be a drag on the community into someone who's contributing to the community. Grayston Bakeries in Yonkers, New York. And if you eat Ben & Jerry's ice cream, you're eating the brownies that Grayston Bakery produces. They established what they call open hiring. So there's not a job application and no questions are asked. No questions are asked about your experience, about your previous employment, about your involvement with justice, your time spent in prison. No questions whatsoever. If you're willing to work and the bakery has an opening, they will train you and they will help you succeed. Since they began this practice in 1982, they've hired scores of employees who could not get jobs elsewhere and who proved to be stellar employees. Again, this is a win for the community, a win for the employee, and a win for the company. These kinds of business decisions are novel and potentially risky investments in people. They lift up those who are struggling at the same time that they return value to the business. These kinds of actions can be transformative for people, families, communities, and for the businesses themselves. When we give people a chance to contribute to society who otherwise might have been a burden on society, we make a positive impact on income inequality, and we help attenuate the lack of economic opportunity in our country. These are the kinds of investments we'd like to see more businesses engage in. We're trying to raise awareness of the need and the opportunity to make change in communities. We aim to provide tools and resources that businesses and employers can use to be a partner for health in their communities. We aim to foster greater awareness among businesses of the varied stakeholders they serve, like employees, consumers, and communities, not just shareholders, and to instigate action by businesses around meeting shared needs and creating shared value. And we hope to foster connections to call out the community change makers who have been working in the zip code improvement business for decades, and to connect businesses, employers, and private sector resources to these change agents to continue the work of building healthy communities and a more sustainable prosperity. Now, make no mistake, supporting jobs in a community, creating jobs in a community is a huge contribution to health and well-being. Someone once said the most effective social program ever invented is a job. And we're looking for more investment from the private sector. Certainly more jobs, but more in addition to those jobs, and making sure that those jobs are the family-sustaining careers that the Department of Labor talks about. Engaging businesses to be community change makers and forces for health in their communities means growing and building together, not at the expense of communities or employees or customers, and certainly not at the expense of the environment. Communities generally understand their needs, and we had a nice dialogue about that a minute ago. The challenge is marshaling the partners and the political will to implement those solutions that the community knows it needs. Businesses, and I'll include healthcare as a business, are often respected voices in a community. They can become even more politically engaged, and they can take a stand in support of the policies, practices, and programs that strengthen the health of their employees' families, and the future workforce, the next generation. When community health and economic prosperity are seen as being intertwined, with one reinforcing the other in a virtuous cycle, strengthening communities to be places of health and prosperity for all becomes a solid business strategy. We're using 3 strategies to promote our community health and economic prosperity initiative. As I mentioned, we're currently developing a Surgeon General's report on the topic. The Centers for Disease Control and Prevention is leading that report, and you can look for that in the summer of 2020. We're also hosting a set of convenings around the country, as I mentioned, to both lift up existing solutions and to identify new ones. Each convening focuses on a specific topic and in a particular location, bringing together businesses and other community change makers who have engaged in this kind of work, who have solutions to share, and who are eager to learn additional strategies to deploy. And finally, especially around the convenings and also just the Surgeon General's visits around the country, we rely on our media and communications colleagues to amplify the CHEP messages, to reach diverse stakeholders, and to help contribute to a national movement around health and prosperity. So why might this all matter to you? It's imperative that we address these upstream problems, and I think there's been a nice trend here with the three speakers really driving home that point. And we have to do that, as one of the questioners noted, even as we continue to address the current burden of chronic disease and substance misuse and other health problems that are so debilitating to our people. I said earlier that communities have the solutions, they know what they need, and there are many examples of resilient and thriving communities, and many more that are striving and aiming to implement solutions and working toward improvements. So my key message to you as you embark on your journey in this space is that no one needs to invent anything new, except potentially new relationships and new partnerships. The organizations, the community change makers, the proven policies and practices, they're all here already, waiting to be unleashed. The trick is to unleash them for the benefit of the many and not just the few. The trick is to advance those solutions that lift up everybody, because looking out for the other guy isn't just good for the soul, it's good for business. Diminishing inequality and increasing opportunity are good for our economy and good for our future prosperity. As businesses, both for-profit and not-for-profit, living and working in Chicago, you all know your communities. You are connectors and you have powerful voices. You know the landscape, you know the players, you have the relationships, you know what relationships you need to build. You can work with local public health, you can work with community development financial institutions, you can work with anchor institutions. Likely you are an anchor institution. You can bring business leaders to the table. You can be the business leader at the table. You know the bankers, your company, your hospital is likely an investor. You can make decisions about how and who you hire. You can build pathways to employment in your community. You can cultivate local vendors. You can nurture local entrepreneurs as you are procuring goods and services for your businesses. Community health and economic prosperity, CHEP, may be an inspiration to you to make the case, to come together, to invest in a place and build a healthier, more prosperous future over the long haul for this generation and for the next generation. So this slide, like John's, captures some of the actions that businesses and others can take to improve the health and economic prosperity of a community, for employees, for families, for residents, for consumers, for communities, for the current workforce and for the future workforce, to address both the symptoms that hold our places back and the root causes, the income inequality and the lack of economic opportunity that are antithetical to our values as a nation and are compromising our shared future. Thank you.